we're at StemRx and we're speaking to Dr. Pallavi. She's an expert in regenerative medicine and fertility, as well as in cosmetic gynecology. I need to ask you, what is infertility?
So, if we talk about the infertility, it is the condition when the parents come, means any couple is trying for the issue, like you say, child or conception since 1 year, but they are unable to conceive even without using OC pills or like you can say any intrauterine device, then we can call it as infertility. So infertility may be of different types, like it's primary and secondary. In primary, when we talk it as a primary, the couple has never conceived earlier, right? And when we talk about the secondary infertility, it means couple have already one issue or more than one issue, but now they are trying for another one since 1 year and they are unable to conceive. So then we call it as a secondary infertility. So nowadays this issue of infertility increasing day by day because of lots of problem and stress people are facing. You can say the delayed marriages, work commitments, delayed marriages.
So all the longer you wait.
Yeah.
Okay. And then you said that's primary. So is there? You said the secondary. What's the secondary infertility?
Yeah, in secondary, couple already have the issues, one or more childs, but now they are trying since 1 year without any contraception, without any OC pills or condom, you can say the barrier contraceptive or intrauterine devices, but they are unable to conceive. Then we call it as a secondary infertility.
Oh, okay.
So there are lots of causes for that as well, because earlier they have a child but now they are not able to conceive. So many a times couple think that I am not infertile because I have a child, then how can I become infertile? But but there are so many different causes for that.
So what are the causes?
So there are different causes for primary infertility and different causes for the secondary infertility. Like when we talk about the primary infertility, means the couple never conceived, right? So there are so many causes like anatomical defect may be there. If we talk about the females, the anatomical defect may be in the ovaries or tubes or uterus or cervix or vagina. So in ovary there may be a cyst like fluid filled cavity over there, or some blood filled clots may be there inside the ovary, which is also called as endometriosis. Then there is also a decreased ovarian reserve, the condition which we call decreased ovarian reserve. Then there is another condition when the tubes may be blocked, or sometimes because of infection or inflammation the cilia inside the tube may get damaged, because of which the gametes may not travel through the tube, like sperms may not travel through the tube to the ovaries, and embryo may not transfer to the uterus. This condition may be happen. When we come to the uterus there may be a problem of septum, sometimes decreased uterine cavity, sometimes there may be a lump which also called as a fibroid. So it will also decrease the uterine cavity, and there may be a problem of implantation as well. Then when we came to the cervix, which is the mouth of uterus, so sometimes it may be narrow, which is also called as the cervical stenosis. Sometimes there may be antibodies against the sperm, which may kill the sperm at that point only. That may be a problem. So in female, the anatomical problems are like that. When we came for the hormonal problem, so there may be a problem of hyperthyroidism, hypothyroidism, hyperprolactinemia. These are the conditions may lead to the infertility. There are certain problems which are environmental as well. Some immunological problems as well, means the condition of autoimmunity may lead to the infertility. Okay. So when we talk about the environmental problem like our lifestyle, the obesity, all these contribute to the like stressful condition, all these contribute to the hormonal irregulation.
Yes.
and leads to the infertility. So in female, these are the problems for the primary infertility. In male, the problems are different. Like sometimes there is azoospermia. Azoospermia means decrease sperm count in the semen, or absolutely absence of sperms in the semen. Okay. So sometimes there is a problem of erectile dysfunction. Sometimes there may be a problem of torsion of testes. Sometimes testicular atrophy. This may be because of the hormonal imbalance, decrease some hormones like thyroid and prolactin. These are also the problems. Sometimes there may be an infection. Sometimes surgical conditions like you say, some males are operated for hydrocele or hernia, which may cause the injury to the spermatic cord, like appendicitis operation as well. So these are the conditions which leads to the male infertility. Okay. So when we say the couple is suffering from secondary infertility, means they conceived earlier but not conceiving now, because the advancing age of female also contributed for that.
Right.
It leads to the decreased ovarian reserve. It also hampers the quality of oocyte, right? And there may be a problem of sometimes because of the repeated abortion, because of curettage, there may be an adhesion inside the uterine canal, which also hampers the implantation next time. Sometimes there may be a surgery over the uterine cavity, like fibroid surgery or cesarean section, which may also lead to the implantation failure. So these all, and in male the problems may be same. As the age advances, lots of people are suffering from the diabetes, hypertension. These are also the contributing factors for the secondary infertility.
Makes sense. With age, things change.
Yeah.
Okay, so I was thinking, some women might wonder if it was their fault, or is it something that they did to cause this infertility?
Yeah, that is very good question actually. Many a times only female are considered to be problematic in infertility, but it is not a truth actually. Male and female equally contributed to the infertility. You can say the 40% of the male and 40% of the female contributed to the infertility.
Okay.
Rest are the we can say it is a unknown infertility.
You don't know.
Yeah, the cause we don't know. So 10% of the time it is a unknown cause of infertility.
Okay, so it's no one's fault really.
Yeah,
Well, it's equal fault.
equally contributed.
Yes. Okay. So, how does regenerative medicine fit in here? What is regenerative medicine? I heard that will help with infertility.
Yeah. This one is very nice question and one of my favorite question actually, because I am working in regenerative medicine and I am very keen to give the patient of their own origin, their own biological child to them.
Yes.
Because most of the time the patient give up by saying there is a decreased ovarian reserve, so they need to do the donor oocyte or donor sperm cycle.
Unfortunately.
Yeah.
But it's okay, it's a nice option.
Yeah.
If someone wants their own.
Yeah, but regenerative medicine is doing lots of work in that. With the advances in the science, we come up with a beautiful technology that we can give them their own original child, of their own origin, you can say, own chromosomal pattern and everything. So the regenerative medicine is the combined approach, you can say, of the cells, the mesenchymal cells, mesenchymal stem cells. It also contains the PRP, that is platelet-rich plasma. Then it contains the exosomes, the cytokines, growth factors, the quantum energy, detoxification of your body. So every approach or every the improvement and new technology, whatever coming in the science, for the improvement and the regeneration of our body cells is the regenerative medicine.
Okay.
So main part of this is the stem cell. So stem cell has the capacity to regenerate, replicate and repair whatever the problem is there inside the tissue.
Yes.
So when we put these cells in particular microenvironment, they have capacity to divide into that kind of cell. So this is the beautiful phenomena which we are going to use in regenerative medicine for infertility patients.
What I love that I'm hearing is that there are so many options.
Yeah,
Yes.
there are.
That's nice. Okay, so what conditions can be treated through regenerative medicine?
So there are lots of conditions nowadays which can be treated with the regenerative medicine. Like in conventional medicine, when there is a decreased ovarian reserve, we always have the option of donor oocyte. But with the regenerative medicine, we have the capacity that these stem cells can be converted into the oocyte when we put it into the particular microenvironment. Microenvironment means the ovarian condition, whatever the situation is there, the temperature, the pH, the growth hormones, the cytokines,
Yes.
all these need to be make sure that it should be in that microenvironment. So it get converted into the oocyte, into the germline cells. So decreased ovarian reserve we can treat with the regenerative medicine. Then there is again condition like PCOS, because in regenerative medicine we are also going to improve the signaling from the brain, which is coming from the brain, hypothalamus and the pituitary to the ovary, so that the proper channeling is there and proper signal will come, proper hormones will secrete, and this PCOS like condition can also get healed with the regenerative medicine. Then there is again problem of repeated implantation failure. Sometimes the uterine environment may not be good to implant the embryo, even though you put the good quality of embryo inside the uterus, but the implantation may not be good. There is a repeated implantation failure, repeated IVF failure. In that case, sometimes the receptivity of uterine tissue may be decreased. So with the regenerative medicine, we can also help such kind of patient to get their pregnancy back. We can also solve the problem of thin endometrium with the regenerative medicine, because thin endometrium means normally we want at least 6 millimeter of thick endometrium over there.
Yes.
And vascularity means blood supply to the uterine tissue should be good.
Yes.
So with regenerative medicine we can also help to manage that endometrial lining. With, you can say, the extracellular matrix is also a part of regenerative medicine which we can use, or mesenchymal cells which can regenerate that endometrial lining. In certain conditions like Asherman syndrome, when there is a fibrosis inside the uterus, so these mesenchymal cells also have anti-inflammatory property. If there is inflammation of endometrial tissue, it is going to help them in decreasing their inflammation. They also have anti-fibrotic property, means if there is a fibrosis, it is going to heal that fibrosis and regain that endometrial lining. So the implantation will be good next time when you put the uterus inside, embryo inside the uterus. So in this condition as well, you can take the help of regenerative medicine. In case of male, if there is a azoospermia like condition, when there is no sperm at all inside the testes, regenerative medicine can help you to form the sperm as well. Yeah, that's really very interesting.
That's revolutionary.
Yeah, that's happening in our lab actually.
That's amazing.
Yeah, so these stem cells are amazing. They can replicate in any kind of cells.
Wow. Wow.
So
Okay.
in male infertility as well, they can get help.
So for male and female infertility.
So whatever is difficult with the conventional medicine, you can always take help of regenerative medicine.
So what other conditions of the reproductive system, apart from infertility, can be managed with regenerative medicine?
Yeah, this one is very good actually. Although I am in infertility, but apart from this, it is really interesting to know that there are certain conditions which can also be helped with the regenerative medicine,
Yes.
like reversal of menopause.
Wow.
Certain females are there which are suffering from the menopausal conditions like hot, hot flushes, night sweats, osteoporosis like condition because of decreased estrogen level inside the body. Because as the age advances, the oocytes are get diminished, and patient land with the hypoestrogenemia, which leads to the heart attack like condition as well. Yeah. So we can restore this menopausal condition, reverse menopausal condition with the regenerative medicine. This
Reversing.
one, yeah.
Wow.
This one is the very good and really very helpful for the menopausal females. Then in male, you can say lots of male are suffering from very stressful condition when there is a problem of erectile dysfunction, which can also be taken care of with the regenerative medicine.
Is there anything that you would perhaps like to say to anyone watching now? Maybe something encouraging, a message from you?
Earlier, the patients suffer from so much of stress because of this, so much of depression, you can say, that they cannot get their own baby. But like in 21st century, there was the option only like using donor oocyte or sperm. But with the lots of advances in the science, they can have their own child with the regenerative medicine. That's what I can say. So never lose hope. Regenerative medicine can help you in having your own child.
That's amazing. Thank you so much for chatting to me and taking the time out of your very busy day. I know you're very busy.
Yeah. Thanks, Sherry, for inviting me in your show. I think this creates awareness in the people that don't know about the regenerative medicine.
Yes,
Thank you so much.
Okay, thank you so much.